you are a pioneer in a way, that you are one of the first people who did a fellowship specifically in this area. Is that right?
Yeah, yeah. A few years back, yeah, I was one of the maybe first three people to do like a formal surgical fellowship in advanced gender surgery.
And how did that come about? Like, how does it just for any field? Like, how does a new
Yeah,
fellowship like that, where the cutting edge is like literally at whatever your scalpel is,
yeah.
how does that work?
Um, it was just dire need. So, my kind of pathway into gender affirming surgery, I was a plastic surgery resident in Canada, and we had started doing some gender affirming mastectomies or top surgeries. And I'm someone that's from the queer community who was also going through like my own phase of growth of just starting to expand into hanging out with people of like gender diverse trans identities and starting to understand, like, in a very developed country, why are people having to go to Thailand or Europe to access like what's supposed to be this medically necessary procedure? Why am I, as a plastic surgeon, not getting trained to do any of these things? And then you start asking those questions, and people would have to go overseas and come back and have no follow-up care. Like, it was just abysmal, like the resources that people were provided, which was in effect none. Like, basically it was community supporting community the best they could to get the care that they needed. And I decided, like, there's got to be a better way, and we have to find a way to like integrate this into academic medicine, because we all train in academic medicine. That sets the curriculum of which we are all competent. And if we don't get this into academic medicine, then we're never going to meet full demand and like normalize it in the way that it needs to be normalized. So I set out on this multi-year process trying to figure out, well, where the heck can I even go to like learn these things? And was very fortunate to end up at the institution I'm at now, as I was the first fellow here, being trained by both plastic surgeons and urologists, because a lot of these procedures intersect sort of multiple fields of medical practice. And then it's kind of grown from there. There's like 7 or 8 formal fellowships now. I train 2 fellows a year here now. I'm sort of stepping into that role, which has been fun. But all of those things are very, very new. Before, a handful of years ago, people would maybe go watch a surgeon in Europe or Thailand for a little bit and come back and do the best that they could, because that was all the resources that they had. So it's pretty remarkable that it took as long as it did to even have safe surgical training programs for an entire group of people that is like greater than 1% of the population. That's a
Yeah.
lot of people.
Yeah, and I hadn't realized that people were going overseas for that care, but it shouldn't be surprising, because as an emergency doctor, I do see that. I haven't seen it with gender affirming care, but I've seen it with a lot of plastic surgery, where
Yep.
people go to some other place because it's less expensive. And unfortunately, we often see, in this case, not the lack of follow-up being the problem, but the lack of quite frankly, just technique, and the side effects from, having gone and gotten a botched, liposuction or something, over, south of the border or something, or overseas. And we see like these terrible outcomes. And it's like, oh gosh, couldn't we have just done that here,
Yeah.
and
I
avoided
mean,
complications? Are people going over, like, are we having that same problem where like the outcomes aren't as good when people go elsewhere?
I'm privileged where I'm at one of the largest programs in the country. So, I'm typically mostly seeing just patients that I'm taking care of or that are coming to me for second opinions. But there absolutely are people that are still going overseas because, they maybe don't have insurance in the US and they're going to have to pay out of pocket. So they're going to go somewhere else. That's absolutely still a thing that happens and can absolutely still compromise outcomes. I think the barrier that people don't realize is there's still like a very limited number of programs to train in a meaningful way. It took me 2 years to figure out how to train in this, and I had to self-fund my fellowship here. It wasn't like a secured funding stream. Do you know how difficult that is on the end of like 13, 14 years of medical education?
Yeah.
So it's like, it's taken a lot of people, like a lot of blood, sweat, and tears and personal sacrifice to like make this tangible. What's exciting is institutions and organizations are stepping up. Like, even in the last 5 years, gender affirming surgery is a recognized like core area of training in plastic surgery now. It has sections at all of our meetings. It is in our plastic surgery journals. Every year, at least one new fellowship gets added. So things are drastically changing, which also kind of sort of contradicts what's happening socially, politically, where
Yeah.
medicine wise, like, care is getting better and education is rapidly getting better. And we're seeing a lot of sort of, I'd say, regression in the social landscape. So there's a bit of a disconnect happening.
And you said the students are obviously integrated in this because it's just part of the continuum of care now. It's not really outside of that. Is plastic surgery becoming, and not that it already wasn't a huge draw for students, but is there increased interest out of students who are interested in helping this underserved community?
Oh my gosh, yeah. I mean, to anyone that is worried that things aren't going to get better, all you have to do is talk to the younger generation who, I mean, they are like demanding LGBTQ plus education from like day one of medical school. And if the medical school is not doing a good enough job, they're bringing it in themselves. Like they are absolutely not going to let people be politicized or their care be politicized. So like that is what inspires me more than anything, and why I do a lot of this work is to just keep that door open and hold these spaces and show people that these careers are possible, because there's an absolute tidal wave of providers coming behind me that are going to have very similar career trajectories. So like that change is absolutely coming. Because I think like, the students are just tired of it. Like people are just people. Like we all deserve to make decisions for ourselves and live the lives that we want. And they're, I think the first generation, like really holding that line, and institutions are shaped by the people inside of them. And medical students are collectively a very powerful group of people. They're a future of healthcare and they're shaping it.
That's great. Anything you want to add, a parting message here during Pride Month and raising awareness for gender affirming care?
Yeah.
What's your message to people who maybe don't get it or who are curious? Like, I'll give her the
Yeah.
floor.
I think you don't need to understand someone to respect their choice to be who they are. Um, I think more than anything, that's what this is all about. And I think it's very easy, particularly in this present time, to feel like things aren't going to get better and they're awful. But like, I do promise you that they will. And we all just need to keep doing the work, but also holding each other accountable. So to anyone that is like a healthcare provider or at an institution or an organization or in medicine, like this is actually your job too. And like you should be carrying that burden. You should be looking at, well, like, what is my organization doing? Do you have a statement? Like start asking those questions, because that's really what we need. It's not about trans people advocating harder for themselves. It's not about the gender affirming providers continually fighting these battles. It's about people taking that tax off of us, and making it clear that we as a field are supportive of people accessing the healthcare they need. End of story.